Good morning, it's Danita from Integrity Coding. I'm going to take a few minutes and I want to do a little instruction on the integumentary system. I hear a lot from students that they find this challenging when it comes to excising, repairs, and mows. I'm going to take a few minutes and hit on some very important guidelines that I want you to take note of. Please get your CPT books ready, and I want you to open up to page 79 in your 2017 CPT book. Now, when I'm teaching my classes, the way I was taught, and it was very helpful, is we broke it down into steps. I also teach asking who, what, where, when, and how. You are not always going to be able to answer those questions, but if you can begin by asking yourself that, the what being, what procedure are they doing? The who being the age of the patient. Not so much in integumentary, but in other sections, the codes are driven by age in some situations. So that's your who. But to get back to integumentary, I want to talk to you about the guidelines for excising and repairs. So we're on page 79 in integumentary, and it talks about a simple repair, an intermediate repair, and a complex repair. So when you're excising, the number one question I ask my patients, is it benign, students, is it benign or is it malignant what is being excised? Number one, is it benign or is it malignant? The second question you want to ask yourself is, what is the body area that they are excising or repairing? Number three, and this is very important, you code all lesions separately. Number four, don't forget rule number 3. You code all lesions separately. So I want you to take a look at your repair codes on page 79. Again, we start off with a simple repair. And what I have highlighted in my book that I want my students to remember most of all is the sentence that says simple one-layer closure. One layer can help trigger you to, this is a simple repair. The next one we have is intermediate, and it says intermediate repair includes the repair of wounds that, in addition to the above, requires layered closure, one or more of the deeper layers of the subcutaneous tissue. Keyword there, layered closure. That should stick out to you. What's also very important, if you read a few sentences, go down a few more sentences, it says single layered closure. Now don't confuse single layer with simple. This is now talking in the intermediate section. Simple layer closure of heavily contaminated wounds that have required extensive cleaning or removal of particulate matter also constitutes intermediate repair. You need to have that highlighted. And even though it says one layer, the key word that's going to tip you to intermediate is when it says they're doing the contamination of the wounds requiring extensive cleaning. Intermediate. You then have your complex repairs, and it states complex repair includes the repair of wounds requiring more than layered closure, vis-a-vis the scar revision, debridement, etc., traumatic lacerations or avulsions. Very important. The key word that it sticks out to me is more than layered closure. So if it's more than a layered closure, you know it's not intermediate. It then is a complex repair. CPT is a great it is a great book. The longer I teach it, I see there is so much more information in here than when you first begin. It just takes the time. You need to set aside the time where it's quiet and you start to really read. You're like, there really is good information in this book. So it further breaks it down into steps. Okay? The next thing I want to bring to your attention is in adjacent tissue transfer. We had this the other night with a student that I was working with. And on the exam, you need to be able to quickly start to eliminate, process of elimination, what code is correct and what code is not. So when you turn to page 82 in your integumentary coding book, look at adjacent tissue transfer. Codes 14000 through 302 are used for excision, including the lesion, and or repair by adjacent tissue transfer or rearrangement. For example, Z-plasty, W-plasty, V-plasty, Y-plasty, rotation flap, random island flap, and advancement flap. When applied in repairing lacerations, the procedure list must be performed by the surgeon to accomplish the repair. They do not apply to direct closure. When you're hearing do not, that you pay attention to that. They're giving you an instruction. They do not apply to direct closure or rearrangement of traumatic wounds. Key word there, traumatic. So in my old book where I had a lot of my notes, I had an instructor at Absolute Medical Coding. She was really good about pointing that out. It does not include traumatic injuries. So again, let's read that. When applied in repairing lacerations, the procedure list must be performed by the surgeon to accomplish the repair. They do not apply to direct closure or rearrangement of traumatic wounds incidentally, keyword, resulting in the configurations, undermining alone of adjacent tissue to achieve closure without additional incisions do not constitute adjacent tissue transfer. See complex repair. Additionally, what is very important, very, very important, is the next sentence. The excision of a benign lesion or malignant lesion is not separately reported with codes 14000 through 14302. You need to know that because when you're on the exam and they're talking about an adjacent tissue transfer and they're talking about the incision, if they give you a code for that benign or malignant excision, you know it's wrong because guidelines tell us you cannot code that separately. Passing this exam and becoming a proficient coder, and as I call it, a coder with excellence, is always going to come down to knowing your guidelines. For the exam purposes, remember, they're not asking you to be a proficient coder. Well, yes, they are asking you to be a proficient coder. They're not asking you to know this book in and out. They want to know that you can navigate to the guideline and follow the rules that they're stating. So highlight the words that we just spoke of. Remember what we reviewed. You want to know the difference between a benign lesion or a malignant lesion. What is the body area that they are excising? You code lesions separately. And the next rule is you don't forget that you code all lesions separately. Remember what we spoke about in adjacent tissue transfer as well. Okay, if you have any questions, please feel free to contact us at Danita@integritycoding.com. You can also contact us at 781-835-7804. We do private tutoring and coaching. We have CPC boot camps and review classes. I love the boot camps. The longer I do them, the more I enjoy them. One of the reasons I do is because students have such great success. So many students pass the exam after attending these boot camps. We offer online courses and classes. If you're in the Boston area, we have a 4-week course coming up in November. This is a CPC exam review and prep. These are with AAPC practice exams that is included in the price. So for more information, feel free to contact us. Read over your guidelines for integumentary. Coding's all about guidelines. Okay, have a great weekend, everybody. Bye-bye.